All right. Good morning. Welcome to the PTI Nice Daily Show. Happy Friday morning. I hope your morning is off to a great start. My name is Alan. I'm happy to have you here on the Daily Show, here on Fitness Athlete Friday, the best day of the week. I currently have the pleasure of serving as the Chief Operating Officer here at ICE and a lead faculty in our Fitness Athlete division. Fitness Athlete Friday, we talk all things fitness athlete. We're talking about the CrossFitter, the Olympic weightlifter, the power lifter, the recreational gym goer, the endurance athlete, the runner, the cyclist, the triathlete, all sorts of things of folks who get after it and exercise on a regular basis. Here on Fitness Athlete Friday, we have a couple of courses coming your way. If you're looking to learn from us online in the Fitness Athlete division, your next chance to catch Fitness Athlete Advanced Concepts will be 26 February. So that's about 6 weeks from now. That is our level 2 online course that's starting in February. You must have taken Essential Foundations to take Advanced Concepts. Zach, Mitch, and Joe take you through a whole bunch of advanced fitness athlete training, programming, looking at gymnastics, Olympic weightlifting, very in-depth, robust course. And then the precursor to that course, Essential Foundations with myself, Mitch, Kelly, and Guillermo. The next cohort of that will start March 6th. Both of those courses are already on their way to being full. Advanced Concepts is only taught twice a year, is already about 60% full. Will definitely sell out before that start date on February 26th. And then Essential Foundations is taught 4 times a year. It sells out every time. It's sold out every cohort for the past 5 years. This cohort will sell out before the start date. So if you're thinking at all about that course, you need to jump in now and grab your spot. Once they're gone, they are gone. If you're looking to learn from the Fitness Athlete division out on the road for our 2-day live seminar, a couple of options coming up in the next month or so. February 4th and 5th, Joe will be down in Doral, Florida. That's right outside of Miami. The weekend of February 11th and 12th, Mitch will be up in Stillwater, Minnesota. The weekend of March 4th and 5th, Joe will be down in Amarillo, Texas. The weekend of March 18th through 19th, Zach will be right outside of Springfield, Missouri. And then the last weekend of March 25th and 26th, Mitch will again be on the road out in North Platte, Nebraska. So over the next couple of months, a couple of different chances to learn from us across the country. As always, check out ptonice.com for all of our upcoming live and online courses. Let's get into today's topic. Is the CrossFit Level 1 certificate course an appropriate barrier to start coaching CrossFit, to open and operate a CrossFit gym or fitness facility? So this is often a critique of a 2-day course is maybe not robust enough as an entry-level portal to begin coaching other human beings in movement, to open your own gym and start to operate a business. So we had the CrossFit Level 1, the Healthcare Provider Level 1, back in December in Boulder, Colorado. We had a good crew of 40 healthcare providers. I would say over half of them were physical therapists. And there was a lot of sidebar of, this is it. This is the course. After this, I can coach CrossFit. After this, I can open a gym and start selling CrossFit memberships and just start training people and call it CrossFit. So we had a lot of sidebar conversations about that. So I want to unpack what actually is in the CrossFit Level 1 course, and then our thoughts on how to make that a more appropriate barrier for entry, or if it already is an appropriate barrier to entry. So my first point here is I want to actually talk about the course itself and the pros and cons. It is a course. It's a 2-day live course. It is open to anybody. You need $1,000 and you need to have graduated high school, right? You need $1,000 and a pulse, essentially. Very low barrier to entry as far as what sort of educational background you need. And overall, considering how much money you can spend on courses online or live in the fitness realm, I would say it's a relatively low barrier to entry to just pay $1,000 and that's it. After that, you can go and say you're a CrossFit coach. You can get a job as a CrossFit coach. You can market yourself as a CrossFit coach. You have the necessary certification to open up a CrossFit gym, versus a lot of other organizations out there have, yes, more courses, but with more courses comes more time and more money. What is inside of that course? If you haven't taken it, I highly recommend you take it. I think every physical therapist should take that course. They have a course just for healthcare providers. Spoiler, it's literally the same material that's in the public level 1. The only difference is that to take the healthcare provider level 1, you need a medical license. So you're going to see physical therapists, OTs, nurses, physicians, anybody with a healthcare license is going to be in that course. So you're in a group, I guess, of people you kind of already know their background. But other than that, the material is exactly the same. The material is across the 2-day course, instruction on the 9 foundational movements of CrossFit. So they have 3 series of 3 movements. They have a squat series. They go over the air squat, the front squat, and the overhead squat. In the hinge series, they go over the deadlift, the sumo deadlift high pull, and the medicine ball clean. And in the press series, they go through the strict press or the military press, the push press, and the push jerk. Most of the weekend, you never lift anything heavier than a PVC pipe. You lift a medicine ball for the medicine ball clean, and you do a little workout on Saturday and again on Sunday morning, where you do move a little bit of weight in a short time domain, low volume, low load workout. So you primarily kill yourself with a PVC pipe all weekend in a way that only CrossFit can do that. So you learn those foundational movements. The idea there is that among those 9 movements, if we combine some of them together, we will get other movements. If you know how to front squat and you know how to push press, you should then know how to string those 2 together and do a thruster, right? If you know how to do a front squat and you know how to do a medicine ball clean, it shouldn't be that much more of a stretch to teach you a power clean or a squat clean. If you can overhead squat, so on and so forth, we can teach you to snatch. In addition to those 9 foundational movements, there are some gymnastics and Olympic weightlifting. You will learn all about the pull-up, how to introduce the pull-up, strict pull-up, regressions, progressions, the initiation of the kipping pull-up, regressions and progressions for the kipping pull-up, and you'll practice some kipping pull-ups, all in a practice environment, not in a workout environment. You will do the same for strict ring muscle-ups. You will cover the GHD machine, GHD sit-ups, GHD back extensions, GHD hip extensions, GHD hip and back extension combined. And then you will also go through a primer for the snatch, again, using a PVC pipe. And the idea is that all those movements combined, encompassing together, will let you theoretically introduce and coach the 300-ish movements that we cover in CrossFit on a regular basis as we cycle through movements throughout weeks, months, years. So that's the movement. In between, you have lectures. You have a lot of lectures on nutrition, programming, talking about chronic disease, talking about actually what is intensity, how do we start to measure this stuff and get objective, that are interlaced in between the movements. And then you end the weekend with an exam, a written exam. So pros and cons here. Pros, again, that low barrier to entry, $1,000 high school diploma, getting people out on the battlefield to start coaching CrossFit and start helping out in this fight against chronic disease. It is, for a 2-day course, it's a lot of stuff. It's a robust 2-day course. You will be tired of moving a PVC pipe, of trying to hold that PVC pipe in the front rack position, shaking to try to lift your elbows up and work your T-spine against a PVC pipe for minutes at a time. You have a wonderful blend of introducing movements, coaching, cueing, correcting movements, and then going back and forth between lecture. And then what I like is active participation is required. You have to do these movements. You have to practice these movements. If you physically can't, everyone teaching you the course is also a coach, conveniently, who can show you how to modify and scale these movements so that you can actively participate in the course. It is not just a book test. A lot of certifications and courses in fitness and in physical therapy are just book tests, right? There is no practical evaluation of anything that you do. You have both components in the CrossFit Level 1 course, which I think makes it a very robust course, even if it is just a 2-day course. The cons: it is a 2-day course. You can only learn so much in 2 days, right? You can only learn so much about a small amount of topics in the grand scheme of things across a 2-day course. With that, unless something happens in your group or to you personally where you need a modification or scale, not too many scales or modifications are just given out of, here are the 19 different ways that you could modify a strict pull-up for somebody, that you could do a toenail pull-up, a rack pull-up, a banded pull-up, a pull-up negative. Here are a bunch of different ways you can modify a kipping pull-up, a toe touch kipping pull-up, a banded kipping pull-up. That kind of stuff is not given unless you or someone in your breakout group specifically needs it. And that's kind of where the magic of CrossFit is, of learning All of these movements are a continuum. I can take that person in front of me with what I know about their movement capacity, their injury history, their psychological tolerance to doing this stuff, and they can fit somewhere along the continuum. And I can find an option for a movement that looks similar to what everybody else is doing, and give them an intended stimulus of the day, which is our goal as a coach, is to make sure that everybody leaves having felt essentially the same after completing the workout. And then there's no third party evaluation of coaching or facility after you finish the level 1 course before you might go become a coach yourself or open your own gym. So the question after taking a level 1 course, wrapping up this first point here, is, are you ready to open a gym after you take the level 1 course? And I think that's going to be wildly variable. It's going to depend a lot on your movement background. Have you been doing CrossFit for 10 years and now you're just going to get your level 1 and you're thinking about coaching or maybe opening your own gym? What is your business background? Do you run your own small business unrelated to CrossFit? Do you have some robust business or management or leadership background? Those kind of variables are going to determine if you are, quote unquote, ready to do this or not. So we have to pause and say there are always going to be people who think they're ready when they're not, right? Every profession, every walk of life is full of those people, and they tend to not do well, right? Jeff Moore here at ICE, the CEO, likes to say, get good, not busy. Focus on really developing your skill set, on really building a lot of nice relationships and really cementing yourself in a community, and focus on getting really good at your craft before you decide to strike out on your own and just try to attract as much business as you can. Nonetheless, there will always be people who focus on getting busy, not good. And there's nothing we can do about that. No amount of coursework or books or tests will help filter those people out. They are who they are. Some of those people have to learn the hard way. They have to start a business and fail and spend all of their life savings on it to learn, I don't know what I'm doing. I was really confident, maybe overconfident. Maybe I didn't understand the market in my area, and I blew my life savings, or I blew my 401k, or I took out a third mortgage on my house, and I kind of just ruined it all by trying to get busy before I got good. And there's no training that can prevent that. That's a life lesson. That's a baptism by fire moment. So saying that we need to have more courses to prevent that from happening, to somehow turn a poor leader or a poor business owner into a good one in order to be a good CrossFit coach or CrossFit gym owner, does not make any sense. My second point here is to say something about stones and glass houses, right? What is the barrier to entry to physical therapy practice? I would argue overall it's low. Most folks going to physical therapy school are paying hundreds of thousands of dollars to the school, but they're usually not paying with their own money. They technically don't have any skin in the game. They're signing some paperwork every 4 months that gives $30,000 to the school that person does not technically pay. And they're making a deal with the devil to have basically student loans for the rest of their lives after school. But in the moment, the barrier to entry there is low. Many schools do not even have an interview process. It's all paper application. It's all book type testing. The GRE, fill out an application, answer some interview questions, sign that loan form. Hey, you don't even need a credit check. The government's just going to give you that money, right? It's all a high interest, not subsidized. The government loves for you to take those loans. The school loves for you to take that loans. When we step back and look at it objectively, the barrier to entry to become a physical therapist is also quite low. There is not an evaluation of your skills or how you practice or how you talk to patients. Are you inappropriate with patients? Do you just stand there like a weird robot? None of that is evaluated in order for you to get your license. You sit down and you take a book test, right? So we look at how robust is that compared to the CrossFit level 1. Yes, it's shorter, but in the mindset of what we get inside of 2 days, we get a nice combination of practical and didactic, which we don't really see when we are assessed to get our license to become a physical therapist. So again, we have to be careful we don't throw those stones when we live in a glass house. Furthermore, I would argue CrossFit is a little bit more stringent in that in order to call yourself a CrossFit coach or say that you are a CrossFit gym or you're a CrossFit gym owner, you must have gone through that CrossFit level 1 course. The same is not true for physical therapy. You do not have to be a physical therapist to own a physical therapy practice. There are literally tens of thousands of PT clinics that are not owned or operated by PTs. They are owned and operated by business people who think having a PT clinic is a good return on investment, right? We have very large physical therapy clinic chains across the country that are not owned, operated, or managed by physical therapists. They are owned, operated, and managed by investment capitalists, investment bankers, and their goal is to turn a profit and not to deliver high quality care. So again, we need to be careful that we don't throw stones when we live in a glass house, and that arguably maybe the CrossFit Level 1 is more robust than we think when we sit back and look at it objectively. And then my final point here, criticism often take more courses. You need more courses to be able to coach human movement. You need to learn more. You need more didactic. You need more hands-on. And the truth is, the argument here, the point we're trying to get to is we want coaches to be more of a bridge between the fitness and the rehab space to understand how to more safely have people perform CrossFit so that the injury level gets lower. The first thing we acknowledge is that the injury level in CrossFit is incredibly low, around 3.5 injuries per 1,000 training hours. So if we extrapolate upon that, if you go to the gym every day for 4 to 6 days per week, you can expect to encounter maybe 1 injury per year that affects your function. That's pretty low. When we look at the research and compare that to other fitness modalities, it's on par with Olympic weightlifting. It's on par with powerlifting, with recreational gym activity, with going for a run, with hopping on the bike. It's one of the safest things you can physically do. So we need to acknowledge the injury risk is very low already, and that more courses or more time being evaluated is not necessarily going to bring that number down already, because it's already quite low. We also need to recognize that there are a lot of people, and there have been a lot of people who have been walking across the fitness rehab bridge for every day to go to work for quite some time. Some folks have been in the CrossFit sphere for 5 years, 10 years, maybe even 15 years, working with CrossFitters, working with coaches. When they hear that we need to, quote unquote, bridge the gap between fitness and rehab, they think, I drive over that bridge every day to get to the gym where I work with CrossFitters. Like, the bridge was built decades ago. We're already crossing it. And what we need to say there is we're trying to identify a problem that we'd like CrossFit gyms to have higher quality coaching. And also what we're really saying there is we'd like them to refer us patients when they're injured instead of trying to fix those athletes themselves. And we're trying to give a really high burden solution of just taking more courses, when really we, as the physical therapists who want something from the gym, have the low burden solution in our pocket already, and it's coming alongside that gym. It's recognizing there may be a skill gap. Maybe the coaches at a gym don't understand how to work with pregnant postpartum athletes. Maybe they don't understand how to work with older adult clients, but maybe we do have that knowledge. The solution there is not to have that person go take a bunch of courses and hope to magically learn how to help those populations. The solution is to take the knowledge in your brain of how to help those populations and put it into the coach's brain. How do we do that? First things first, start doing CrossFit, right? Get a membership, get a drop-in pass, whatever. If you are 100% against CrossFit, you're probably not going to thrive well in this space. People are going to pick up on that. The way you probably make little snotty remarks in class about certain stuff or refuse to do things. But have an open mind. Get a CrossFit membership. Start going to the gym. Start going to class. Get to know the members. Get to know the coaches. Help them out. Start to offer, hey, can we do a workshop for the coaches on things to modify and scale for pregnant athletes who are having pelvic floor symptoms? Can we talk about a progression about returning to the gym for postpartum athletes? Can I help connect you with a pelvic floor physical therapist to use as a resource for members who may be having issues during pregnancy or during postpartum? Maybe you are that practitioner already. What about folks who have an orthopedic injury? Maybe you are that person already. Maybe we can start to talk about what to do for medial elbow pain, what to do for a really stiff shoulder, a really stiff ankle. Be that bridge that you want to see built and help those coaches in that gym out by coming alongside of them versus sitting back and throwing those stones at the glass house and telling them they need more courses. They need 3 years of courses. They need to go $500,000 in debt before they're on your level. They don't want to be on your level. They don't want to be 500 grand in debt. They want to be out helping people move more, move better, live longer. And that does not happen inside of a classroom. That happens inside of the walls of a gym. So be that bridge you want to see happen. It's already there. You just have to make those connections with those gyms in your community. We hear very often, we get a lot of emails and messages. I heard it a lot at the healthcare provider level 1. How do I get athletes from that gym? Get into that gym. Go to that gym. Do kettlebell swings and box jumps. Be a member of that community. Be a resource for that community. Ask for nothing. Give. You'll be amazed at the return that you see, not only in obviously your own fitness, but in how those members of the community, how that coaching staff, how that owner starts to trust you in helping take care of those members. Because at the end of the day, a head coach and owner does not want to see an increase in injuries in their membership. They do not want to see people canceling because of injuries. They want to keep people in the gym and moving, and you can be the person that helps that. So the CrossFit Level 1 is a robust 2-day course. We have to be mindful of not throwing stones when we live in glass houses, that our profession is not the most sound either in the barrier to entry to get inside of it, but that we can work together with these gyms, with these communities, with these athletes to go forward in the same direction together. So I hope this was helpful. Happy to hear any questions, comments, concerns, criticism you may all have. If you're going to be at a live course this weekend, if you're going to be down in Georgia with Zach and Sarah, I hope you have a fantastic weekend. Other than that, have a great Friday. Have a great weekend. Bye, everybody.